Hello everyone, today I'm going to be looking at the second half of Reproduction on the Reservation, Pregnancy, Childbirth, and Colonialism in the Long 20th Century. I'm going to be looking at chapters 4, 5, and 6 as well as the epilogue, along with the theme of the politics of reproduction for this week. Just to provide some background on what was happening during this time, we have many Native American families who are moving to the cities, and this was facilitated by the Bureau of Indian Affairs, or the BIA, who distributed pamphlets and promotional materials, basically giving them the message that there wasn't a future on the reservations and encouraging them to move. So because of this, we had the relocation of many women, especially of childbearing age, and the Bureau of Indian Affairs believed that this was necessary in order to ensure the success of the migration program. We have Native American women who are facing many new challenges, especially when they're about to give birth, regarding how they're going to give birth and also how they're going to pay for it. They were encountering the bureaucracy of health services, and it was also difficult for them to get long-term health insurance. So they were mainly relying on their own financial means as well as their kinship and social networks. So we have around 25,000 Native Americans who are moving to cities after World War II, in the decades following World War II, together with the encouragement of the BIA. And although they tried providing financial assistance, these services were limited and inadequate in meeting the needs of the population, especially the female population. And women faced many difficulties. For example, they had to deliver in public hospitals, which were overcrowded and had long waiting times. So women generally responded to these challenges through moving to cities where they had family, where they had someone to rely on, and they created fictive kin networks as well with other Native American families or non-Native American families. And moving to the city also increased the exposure of Native American women to family planning methods, to birth control. They had to decide what they wanted to do once they received this exposure, and they were, of course, influenced by policies surrounding this. After World War II, there were a series of policy changes made by policymakers who wanted to eliminate federal services, which benefited only Native Americans. And part of the acts passed by Congress was House Concurrent Resolution 108, or HCR 108, in 1953. And the intention of this was to assimilate Native Americans as quickly as possible. And as part of these acts, which were passed, federal status of many Native American nations was terminated, and this was known as the termination era, which was a very traumatic period for Native Americans. And healthcare was one of the services that they wanted to eliminate. So as a result, we have the closure of many Native American hospitals, which were closed as a matter of policy, ultimately, and this was also resisted by Native Americans. Another influential moment was the signing of the Indian Health Transfer Act in 1954 by President Eisenhower, and this effectively transferred responsibility from the BIA to the Public Health Service regarding Indian healthcare, and the Indian Health Service was established. And as a result of this, we have an increase of Native American concerns regarding the fact that the PHS was inflexible, and there was the idea that they were privileging rules over the lives of Native Americans. And because of this, PHS advocated for the establishment of health committees at PHS facilities, which would act as liaisons between the Native American groups and the PHS. As a result of this, the Crow Tribal Council formed the Crow Health Committee, which was composed of 5 tribal members who were primarily women, and Susie Yellowtail was the chair of the committee. And this committee was formed in 1956. And part of the goal, especially a goal that Susie Yellowtail advocated for, was for the tribal members to use the reservation hospital. And through doing this, they would be assured that the Crow Health Committee could then advocate on their behalf and hold the PHS accountable for ensuring quality care. And the Crow Health Committee also investigated complaints of patients and advocated on their behalf. One of the most prominent examples of a woman who advocated on behalf of Native American women was Cassie Cook. Cassie Cook was a young Mohawk mother who was inspired by a meeting of the Six Nations of the Haudenosaunee, and she was inspired by John Mohawk, who was a speaker here, and he believed that control of reproduction was one of the most important aspects of Native American sovereignty. So in 1978, Cassie Cook became involved with the WARN, or Women of All Red Nations. This was a newly established organization, and she had a vision of Native American reproductive justice, and she was very vocal against the coercive sterilizations that were occurring. And Cassie Cook was especially known for her call to return to traditional Native American midwifery and to have greater authority of women in clinics and where women were giving birth. WARN was working with an environment where there was an emphasis on population control and an increase in sterilization, and this was especially emphasized in 1970 when President Richard Nixon signed the Family Planning Services and Population Research Act, which subsidized sterilization for Medicaid patients. So while abortion was still very inaccessible, sterilization was relatively accessible. And this constrained the actions of Native American women and encouraged them to choose more permanent measures such as sterilization. It's also important to note that Native American women didn't request sterilization by themselves, but they were presented with this option by hospital staff, which encouraged them. But then we also had forced sterilization, where women entered the hospital for completely different matters like childbirth or surgery, and they didn't know that they were sterilized until years or months after. WARN partnered with the National Lawyers Guild Committee on Reproductive Rights in order to form the Sterilization Abuse Task Force, and their goal was to end this injustice towards Native American women. And they argued that this was, practically genocide, and they cited the United Nations Convention on the Prevention of Genocide, and they argued that this was genocide and that there was intent to destroy. So as a result, in 1979, we have new sterilization regulations, which is requiring oral and written consent, and it is also extending the waiting period, which previously was 72 hours between consent and the actual operation, and it now became 30 days, and this was seen as a big milestone. As part of this ongoing theme of Native American women taking action into their own hands, we see Cassie Cook launching the Women's Dance Health Program, or the DHP, which promoted health education for Native American women. It had classes and distributed material, and they also trained Native American midwives, and they ran a health clinic which provided care, gynecological care for Native American women, and they encouraged the study of sterilization abuse. And their objective was to make sure that women knew their bodies and that they knew that they had reproductive powers and rights, and that they had rights as patients, which they should take into account when making decisions about what they wanted. Today, there continues to be an effort to decolonize reproduction, and this is seen through things like women reintroducing traditions that had fallen out of practice in the past few decades, and there has been an increase in Native midwifery. Despite this, there is still continuous challenges, which is ultimately due to decreasing services. One example being the closure of the obstetrics department at Crow Agency in 2011. And as a result of this, women who live on the Crow Reservation need to drive an hour and a half in order to get to a hospital that has poor conditions due to staff shortages and a high wait time. And because of this, women are looking for alternatives in how they are giving birth. There has been a rejection of the Western model of giving birth. And we have women continuing to organize to fight for justice for themselves, for their bodies, and for their families.